Good day, ma'am. My name is Franzen HD, grade 11 Tenacity, and I am in the academic track STEM. STEM, science, technology, engineering, and math is such a wide field. This also focuses on logical thought and problem solving that allows us students develop mental habits that will help them succeed in any field. It also provides relevant and real-world exposure to important science, technology, engineering, and math concepts. STEM is based on the scientific method on replicable studies and supporting hypotheses. My topic is human health, titled The Main Factors to Affect Human Health, Reduce Them, and How the Technology Has Improved Medicine. Human health, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The health of a whole community or population is reflected in the measurements of disease incidence and prevalence, age-specific death rates, and life expectancy. A brief history of human health. Nearly all genetic variants that influence disease risk have human-specific origins. However, the systems they influence have ancient roots that often trace back to evolutionary events long before the origin of humans. Here, we review how advances in our understanding of the genetic architecture of disease, recent human evolution, and deep evolutionary history can help explain how and why humans in modern environments become ill. Humans' population exhibits differences in the prevalence of many common and rare genetic diseases. The main factors to affect human health. According to the World Health Organization, the number one main factor is the social and economic environment. There are strong connections between social conditions, economic opportunities, and our health. In a culture of health, everyone has the opportunity to live and heal their life, especially to those who face barriers because of where they live or how much money they make. The number two is the physical environment. The physical environment is where individuals live, learn, work, and play. People interact with their physical environment through the air they breathe, water they drink, houses they live in, and the transportation they access to travel to work and school. Clear air and safe water are necessary for good health. And lastly, the person's individual characteristic and behavior. Many factors combine together to affect the health of individuals and communities. Whether people are healthy or not is determined by their circumstances and environment. How to reduce them. Articulates the current understanding of the relationship between the built environment and the quality of air, water, land resources, habitat, and human health. Water development in watersheds reduces the quantity, quality, and diversity of stream habitat for aquatic life. As water is polluted and degraded, it can become unfit for drinking, swimming, fishing, and other uses. Air. More than 38% of national carbon monoxide emissions and 38% of nitrogen oxide emissions come from highway vehicles. Stationary sources like power plants that provide energy to homes, offices, and industries are also major sources of population. Next is climate change. Greenhouse gas emissions from the transportation sector increases 19% between 1990 and 2010, due primarily to the increase in vehicle travel but partially offset by a slight increase in average fuel economy as older vehicles were removed from the roads. Lastly, health. While data are lacking to determine whether the built environment determines level of physical activity or obesity, nearly 90% of studies found a positive association. How technology has improved medicine. Medical technology has advanced rapidly and improve the quality of patient care and medical treatment. For example, high-tech X-rays and MRI machines allow physicians to detect tumor at an early stage and treat cancers more effectively. There are three ways that technology has changed healthcare. Number one, better and more accessible treatment. A number of industry analysts have observed that increased accessibility of treatment is one of the most tangible ways that technology has changed healthcare. Health IT opens up many more avenues of exploration and research, which allows experts to make healthcare more driven and effective than it's ever been. Next is improved care and efficiency. Another key area that the grown and continues to do so is patient care. The use of information technology has made patient care safer and more reliable in most applications. The fact that nurses and doctors who are working in the front line are now routinely using handheld computers to record important real-time patients' data and then sharing it instantly within their updated medical history is an excellent illustration of the benefits of health IT. Lastly is software improves healthcare and disease control. This resource allows medical professionals and researchers to track, retrieve, and utilize valuable data in the fight to control disease and provide better healthcare outcomes in general. Software also plays a pivotal role in tracking procedures and using billing methods not only reduce paperwork levels but also allows practitioners to use this data to improve quality of care and all-around efficiency. Thank you for listening and have a good day.